afternoon, good evening, wherever you're watching us from. We are bringing you an exciting episode on the Scholars Table today. So if you're an IMG or a medical student, this episode is for you. So we are having a special guest, Dr. Danso, MD, MPH, who is the Assistant Chief of Service and a faculty member at the MedStar Health Internal Medicine Residency Program. He graduated from the University of Ghana Medical School, my alma mater. He was a Sommer Scholar at Johns Hopkins Bloomberg School of Public Health, where he completed his MPH and then subsequently went on to do a postdoctoral fellowship in the cardiology department at the Johns Hopkins Medical Institute. He served as a chief resident at MedStar Health Internal Medicine Residency Program, where he did his clinical residency. Dr. Osei has over 70 publications with nearly 1,500 citations. This showcases his significant contribution to medical research and education. So without wasting much time, let's invite our special guest. I know we've been trying to make this interview happen. A lot of people reach out to me. They want to hear the perspective of someone who's gone through the clinical residency program in the US to also share their journey. So I believe that, your experience would provide a lot of information for international medical graduates and medical students who also aspire to take this route. But before we begin, I want you to share some insights about your early life and academic journey in Ghana and what inspired you to really pursue clinical medicine.
Thanks for the opportunity to be here. And I just want to take this moment to commend you for all that you're doing. I know it's been a phenomenal project that you've embarked on, trying to make public health education accessible to everyone all around the world. So kudos on all that you've been able to accomplish so far. So just a little bit introduction about myself. So I was born and raised in Ghana. I grew up in the capital, Accra, but I was born in the eastern region. Had the opportunity to go through basic education at the Youngsters International School in Accra. And then after that, I moved on to Presbyterian Boys Secondary School, Legon, where I did my general science education. And then after that, I moved on to medical school.
You finished medical school in Ghana, you did your house job in Ghana, and then you decided to take a move or make a move to the US. You came in through the School of Public Health. You were a Sommer Scholar, and I think when I applied and I got the Sommer Scholarship, you were the first person to reach out to me and say, hey, I was a Sommer Scholar the year prior, or I'm the current Sommer Scholar from Ghana, and I've heard you're also a Sommer Scholar coming. So during your application process, how did you learn about the Sommer Scholars program at Hopkins? And, what really motivated you to pick Hopkins and not any other school?
Yeah, so when I was applying, I pretty much went through the same thought process that almost every applicant would go through, looking at what public health schools would kind of meet your needs for a great public health education. So I applied and got admission to Harvard, to Yale School of Public Health, and then Johns Hopkins. It was definitely a big decision to make, choosing definitely one school out of a great number of schools for public health training. Before that, when I was applying for the MPH, I had the opportunity to interact with one of my classmates from med school who was already in the public health program at Hopkins. And then I knew a good number of Ghanaians that had also gone through the public health training at Hopkins, who spoke volumes about how extensive, rigorous, and fulfilling it is. So I had a bias at the time, coming into the program. And for me, Hopkins was and still is the number one public health school in the country. And with my interest in epidemiology and biostatistics, it's definitely one of the institutions with a really strong emphasis on epidemiology and biostatistics. So it was kind of a no-brainer for me that this will be the institution that will help me flourish in my clinical and public health career. Aside that, definitely having the opportunity to be a Sommer Scholar was the icing on the cake for me. And the Sommer Scholars program has been a really instrumental and uplifting part of my training at Hopkins and looking back in general.
All right. So let's briefly. I know I have a lot of content on how to apply to School of Public Health, but if you can summarize your experience applying to the School of Public Health in the US, how would you summarize it?
Yeah, so I know you've had several sessions with several honorable guest speakers from deans and all that speak to this topic. What I'll say, and it's pretty much the same process for the residency program, it's a holistic review process.
Mm-hmm.
I know that sometimes people may be more focused on just one part. So back then there was a GRE requirement. Most people would be focused on getting amazing scores, which is good, and then they would not put so much emphasis on other parts of the application. But what I'll say is a holistic process.
Yeah.
And even for the Sommer Scholars program, they're pretty much looking out for leaders, people that have made significant impact in the global health field, people that have a lot of passion to make change, like in the world. So whatever capacity you find yourself in leadership, in motivation, in mentoring, when it comes to public health, when it comes to raising the next generation of public health leaders or physicians, it's definitely something that is very important to highlight. So it's a holistic process. Obviously, if you're getting great scores on your GRE, which now is not like a strong requirement, that's good. Getting great recommendation letters, and that's something that I would also want to put an emphasis on, because sometimes that's one of the selling points for the application, especially people that are able to write a very personalized letter, people that you spent time working with, that know you very well, that can speak to the amazing things that you've done for the field and all the wonderful things that you envisage you do for public health. So that's something that you want to highlight. And then obviously your personal statement should also be all encompassing. And sometimes it can get very generic. I've had the opportunity to review like personal statements for a number of people applying, and then you notice like it's very generic content. Everyone has a unique story that you can always tell, that brings out the uniqueness in you, and that's something that you want to place emphasis on when you're writing your personal statement, and how you see the field of public health evolving, and what exactly you can also do to contribute as a public health leader. So that's in summary what I'll say people should focus on when they're applying for the public health schools.
All right. Okay. So I want us to explore your time as a postdoc, as a postdoctoral fellow. What are some of the experiences at the Johns Hopkins Medical Institute? What was some of the work that you did? What research work did you do? What are key projects that you were engaged in?
Yeah, so I really enjoyed my time at the Johns Hopkins School of Medicine at the Johns Hopkins Hospital. Around the time I had just moved on from my MPH program, and by the end of my MPH, I definitely had acquired a good number of skills in epidemiology and biostatistics that I could use to do research, and I wanted to kind of reinforce this concept and practicalize them. So that's one of the motivations that led me to do the postdoctoral research fellowship. And I really enjoyed my time, because I believe that was the time of my career that helped me to kind of really structure my thought process when it comes to developing a research question, what to look out for when I'm reviewing journals, and then trying to come up with like projects that would meet the needs of the clinical field, or that would meet the needs of the public health field. And so I really credit my mentors around the time at the Chicago Center, who helped me to become the physician scientist that I've evolved to become. Around the time, I also had the opportunity to get a pilot grant from the American Heart Association, the American Heart Association Tobacco Regulatory Science Center. So this was a grant that was looking at electronic cigarettes or novel electronic products. Around the time, electronic cigarettes had come on the market. People didn't know whether it was like harmful or harmless. Some had advertised it as a smoking cessation like strategy. So I was very excited to be like one of the pioneering physician scientists within this field to build research on its health like effects, like respiratory cardiovascular effects in general. So that was one arm of my research. The other arm was on cardiovascular disease prevention. So did extensive work within this field. We're looking at how we can use imaging biomarkers to predict cardiovascular risk or stratify patients, and then how we can mitigate this risk as early as possible, so that we don't get to the point where people are developing cardiovascular events like myocardial infarcts or strokes. And definitely one of the things that I really enjoyed, coming up with a lot of groundbreaking science or research that has been like widely cited all across the world.
Yeah, and I mean, like looking at your citations, I could tell the amount of important work that you've done in the space just within a few years of doing research. So when you were in the MPH program, how did you go about applying for a postdoc position, or how did you get this postdoc position? Because I know a couple of MPH students who says, how do we get postdoc? I want to do a postdoc. How do you get it? So to those folks, what advice would you give them?
So there are definitely a number of ways that you can explore when you're looking for like a postdoctoral position. And one of the things which I would always credit is the kind of mentorship that I had when I was doing my MPH program, and even through the Sommer Scholars program. So you're connected with mentors that are looking out for you, that obviously want you to flourish in your career and all other aspects. So getting to the end of my MPH program, I had a conversation with my capstone advisor at the time, and he was very instrumental in kind of laying the blocks for how to go about looking for jobs, and even reaching out to people like on my behalf. And that's actually how I ended up in the postdoctoral position that I had. The recommendations that you get from people reaching out for you, sending an email, making a phone call, saying that I've had the opportunity to work with this person, he's great, and I know he'll be a great addition to your team. So that's one way that you can explore. The other thing that some of the people in my cohort also did was that, especially those that had maybe surgical interest around the time, and that's one of the things that I really liked about the Hopkins public health training program, was that there were several avenues where you could connect with mentors in whatever field that you were interested in. So those that were interested in the surgical disciplines, there was a J-Score program where you were connected with a mentor that you can do research. And I know a number of people that got postdoctoral research fellowship jobs through their mentors that they were connected with during the MPH program. So that's one option. And then the other option you can also pursue is that there are some postdocs that after a number of years would want to transition onto clinical training, maybe residency or some other position. So if you know one or two people that are in such positions that are moving on into clinical residency or some other position, you can always connect with them, and then they can recommend you to their mentors, and obviously you go through the application process, and then if you're able to land a position there, that would be great. And I always fall back on the leaders in the MPH, especially during the Sommer Scholarship. They were very, very supportive, especially when I was looking for a postdoctoral position. Maridina is everyone's go-to mother of the MPH, would always spend time counseling, helping you to align your interests with particular mentors, and even reaching out on your behalf when you need. So obviously, I think MPH students should have a good communication, candid conversations with their mentors, and they'll be very helpful in helping them to get postdoc positions.
Yeah. So the bottom line is that talk to your advisor, talk to your mentors, reach out to people, make use of the networks that you have at Hopkins, and that eventually will land you in your desired postdoctoral position. All right. I mean, we've explored, post MPH, your postdoc experience, and the amazing work that you did in the field. I want us to pivot back to clinical residency and some of the leadership roles that you played. I know there are students who come in who had already written their US MLE exam before coming for the MPH program. There are others who come in and start afresh, all work. But for you, did you have to write any of your USMLE steps during the MPH program or after the MPH program? And if you did, what are some of the resources that you think are absolutely needed in your preparation?
So that's another great question that I always get, especially when I interact with people applying for the MPH program, because the MPH program is very intense, 11 months program, very rigorous. You're pretty much busy throughout the time that you're here at Hopkins, and combining it with like USMLE preparation can be very tough. So I took my step one during the winter break of my MPH program, and then at the end of my MPH, I took my step two exams. This was very difficult, if I would say, especially combining the MPH, the early part of my MPH training with preparation for step one. What I would say is that I had already started the preparation for the exams before I moved to start my MPH, so that kind of gave me a head start, but it was like all the same still challenging. You've been through the MPH program, you know how intense it can get. So I had to kind of strategize, at least for the first 6 months. And you know that the way the course structure for the MPH is structured, usually the first 1 or 2 weeks within the term are kind of light. So around this time, I would intensify my prep for the USMLE. And then at the latter part of the term, when it gets like more intense, you're preparing for your midterms and then your end of term exams, then I go slow on the USMLE prep. So there are several resources that I used. I do not have any shares in any of the resources that I'm going to mention, which most people have used and found helpful. I think UWorld is one of the things that kind of stands out. Almost everyone uses the UWorld, which is a board prep question bank with several questions for all the steps, and it's pretty much I always tell people that it's a learning tool. For most people, when they start and they're getting low scores on the assessments, they get worried, but my feedback is that use this as a learning tool, because there's much information packed within that. So don't get disappointed by your early assessment scores. So UWorld was one of them. And then there's the first aid for step one, which is also an incredible resource that you can also use. I had the opportunity to use some like learning videos. There was doctors in training when I was preparing for my step one, which is also very helpful. And it's also Kaplan videos. There's even a prep course that Kaplan and some other people organize that you can take advantage of. I didn't do any of those, but if you feel that it's going to be helpful, especially for those that have been out of med school for a while, sometimes going back to step one, which is a lot of basic science stuff, might be very difficult because it's been a while since you revised some of these things. If you think a prep course may be helpful for you, you can go for it. But then I know many people that have been able to take this journey without necessarily having to use any of them. The good thing is that now step one is pass fail, so you don't have to worry about the score. Back then, most people were fixated on getting like a really high score, but you can take the step one pass fail now. But always make sure like you're really gone through a thorough preparation. There's the MBME, which is also another wonderful resource that you can use. It's a lot of assessments that you can just use to test how prepared you are for the exams. And then the UWorld also has self-assessments that you can also use to kind of test your readiness for the exams. And it's an exams that you shouldn't underestimate. You can flaw. So you always want to make sure you're going in as much prepared as possible.
Yeah. I think you've laid out a very comprehensive resource plan for anyone who is interested in doing this, going through this path. So let's look at the actual residency application. I want you to summarize or walk us through what, as an international graduate, right? How do you approach applying to the residency program? What resources do you need, or what requirements do you need? I know you spoke about recommendation letters, you spoke about statement of purpose or personal statement. What are the essential elements or essential tools you need in able to successfully apply for a clinical residency and being successful in that?
Yeah, I just want to throw out there that just a little disclaimer that here not representing my residency program in any way, but then definitely had the experience as chief, having like come to like a close contact with the application process and even going through as an applicant myself. There are a few things that I would want to highlight that potential applicants look out for. So there's the ERAS application system. That is a portal just like SOFAS that you have for public health that you're going to use for your application process. There are a couple of things which are essential. So the personal statement, and like I mentioned, sometimes you read the personal statement and it's so generic. Like once you start reading, you pretty much have an idea of where it's going to end up. But everyone has a unique story, something that is a strong selling point for you. I think that's the thing that you should do, like a reflection of your career, your personal life, and see there's something kind of a highlight about yourself that you can bring to bear when you're writing your personal statement, and you want to make sure that it stands out as much as possible and brings out the real you, so that anyone that reads it or reviews your application would have something that sticks with them. And trust me, I've had the opportunity to read through several personal statements throughout the application process and even as chief, and there are a couple that will really stand out or stick to you because of one unique experience that they're telling you about. So always look out for that. Then letters of recommendation. So this is something that comes up a lot. Sometimes people want to get like letters of recommendation from very big names, which is very helpful, especially if they know you or you have a personal relationship with them. That's very helpful. But the things that we look out for in the recommendation letter is obviously how personalized it is. And for an international, the ability for the person writing your recommendation letter to speak to your clinical skills, to speak to your research, other personal aspects of your life that makes you a stellar applicant is very helpful, so that when anyone is reviewing the application, they know that, oh, this is someone that has made significant impacts in public health, or he's started a YouTube channel that is educating the public about public health education. This is very like something phenomenal that I would definitely highlight on my application or my recommendation letter when I'm applying for residency. So those are the things. If you can get a well-known figure to write you a good recommendation letter, that's good. But it doesn't really matter the name, so long as you're able to get like a really personalized letter from the person that you've had the opportunity to work with. The other thing that I would also want to highlight is clinical experience. So if you get the opportunity to do a clinical observership, an externship, or some form of clinical training in the United States, that would be very helpful, because especially for graduates that have been out of school for a little bit of time, everyone wants to make sure that you're still like in tune with your clinical work and you're able to take care of patients and all that. So if it's been a while since you left med school and you've not had the opportunity to get back into the clinical arena, it will be helpful to take a couple weeks of like observership. And that's one of the things that I really liked during my postdoc training and even my MPH at Hopkins, the opportunity to do some of these clinical observerships, so that you can obviously get a recommendation letter from a mentor that will also speak to your clinical skills. Year of graduation is something that comes up a lot. When you look at some residency programs, they'll say, oh, even more than 5 years out of med school and all that. And it's something that always comes up. I always tell people that don't focus so much about how many years it's been since you left med school, but what has gone into the years since you left medical school.
Yeah.
For someone, it could be an MPH, could be a PhD. You could have served in one capacity doing some absolutely phenomenal public health work. That is impactful, right? So And that's some of the things you want to highlight on your application so that anyone that reviews it will know that in between the time that this person left med school and now, this is some of the significant work that they've made, or this is how they've enriched themselves through advanced degrees and things like that. Sometimes people even do residencies like in their home countries before they apply for residency in the US. This is something that you want to highlight as a unique aspect of your application. So always look at all of this when you're applying.
Okay, so and like you've highlighted all the requirements, but what are the typical timelines for someone who is thinking of, let's say, if I want to start my clinical residency next year, and I have all these elements, when do I start applying?
Yeah, so the next application cycle, so let's say someone that wants to apply next year, the application cycle will probably be opening in the next couple of months, July, August, for people to start the process for the 2025 March cycle. So when the portal opens, I think you have up until September. I may not have like the most exact timelines because things keep just a little fluid and keep changing. But usually by mid-September, you're expected to submit your application. So if you're looking at the 2025 March application, then you definitely want to get things ready around this time. So we're getting to the end of May. You want to get in touch with the people that will be writing your recommendation letter so that they are in the know that you'll be applying. Obviously, you want to get some clinical experience if you haven't already, or start rounding up your clinical experiences. If there's some research project that you're doing and you're pretty much rounding it up, that's also helpful because you want to highlight some of these things in your application. And then mid-September, you submit the application and then you wait for interviews to come in. So you interview pretty much from like October to December. Some programs go as far as like the first few weeks in January. That will be like of 2025. And then you're expected to submit your rank list sometime in February. The programs will also submit your rank list, and then March day will be usually second week in March when the March results will come out. So if you're planning to apply for 2025 March cycle, then these are some of the timelines you want to make sure you're considering.
Okay, so all right, so I want us to look at your experience during the clinical residency training. I know during your third year you were the chief resident, and currently you are the assistant chief of service. Can you describe what differentiates you from the other residents in terms of your responsibilities, your duties as a chief resident? What is truly unique about your position? And as an assistant chief of service, what do you really do?
Yeah, maybe just a little clarification. So the chief resident is the same as like assistant chief of service, and it kind of varies from program to program. There's some programs that you do this as a third year resident, and other programs you do it as a fourth year. So I did it as a fourth year, which is at the end of my residency training. So I did a fourth year chief or assistant chief of service year. And it's been one of the highlights of my clinical training, if I'll say it. So as a fourth year chief, you are an attendant. I had the opportunity to do this on the advanced cardiac service in the hospital, taking care of our patients with complex cardiovascular problems. And so obviously it's going to help like build your clinical skills, team building skills, because you're rounding with residents. And I think a major point of this year as chief is like mentoring and teaching. So you have to use your time to build like strong medical education platforms, if you will, for your residents, and that is teaching them on rounds or coming up with projects and things that can help enrich their clinical training experience. And then when it comes to mentoring, so residents will look up to you, help them like throughout their training, and sometimes even like personal issues that they may be having. And I think it's definitely very rewarding that you have the opportunity to mentor people throughout the process of your chief year. And then obviously there's a strong administrative part of it. So you get the opportunity to serve on various committees, assessing how residents are doing like clinically, assessing the curriculum that is being used for resident education and how you can streamline it to meet the needs of the resident. And then at the hospital leadership level, there are also like various committees that you can serve on. I think it's a very good preparatory year for people that are interested in hospital administration leadership in general, or some other medical education role or leadership, like as a program director or chair of medicine or something like that. If it's one of your aspirations for the future, it's a good preparatory time for your career.
Yeah, I think that sounds like a very wonderful experience. Okay, so I mean, you've shared a lot of info on the clinical residency pathway. I want us to look at your own personal and professional growth. In your journey through, like from Ghana to Johns Hopkins Public Health to the postdoc to your clinical residency, what has been some of the most significant milestones and achievements in your medical and public health career?
Yeah, that's a pretty loaded question. So maybe I would start with like a few of the milestones which I'm very excited about. I think the Sommer Scholarship at Johns Hopkins was one of my like most favorite times at Hopkins because this was a time that helped me to build my leadership, my communication, public speaking, being thoughtful as a public health leader, and embarking on projects that can address specific public health needs. And then obviously the opportunity to interact with public health giants. And that's one of the things that the Sommer Scholarship gave me the opportunity to do, interact with like Danso Osei and all the wonderful public health leaders all across the United States on a one-on-one mentoring basis to kind of help you lay some of the foundations that you will need for your public health and clinical career. So I very much loved that time. The other thing would also be my postdoctoral research fellowship year. So I had wonderful mentors that have supported me throughout my career up until now, and are always looking out for me to make sure that I flourish in whatever field of endeavor I find myself. And I always credit my mentors at the Chikaroni Center at Hopkins, who have been very instrumental in this regard. It's not easy as an international coming through the process and getting people that will support you. So I always like doff my hat to them for the amazing mentorship that I got during my postdocs. So it's definitely one of the milestones that I'm very excited about. The other thing that I'm very also excited about is my position on two non-governmental organizations that are public health focused. So there's Icon Health Systems in Ghana, and then Social Promise in Uganda. And just like the Hopkins philosophy, these are geared towards saving lives, millions at a time. So these are public health like NGOs that are helping with public health education, with medical screening and outreaches, and linking people to care. We have like a really strong support system for Social Promise in Uganda. And obviously I want to invite your viewers, any of them that's interested, to help partner with us and help advance our cause. It's definitely something that I'll be excited about. And then my year as chief resident has also been very fulfilling. I think obviously giving back to my program that gave me a strong clinical training, being a mentor for residents, seeing them grow throughout their clinical training, being a go-to person when they have challenges, providing a listening ear, helping them decipher some of the various challenges that they go through has definitely been rewarding. And then the opportunity to be a medical educator, I believe is some of the fulfilling moments in my career, which I'll always look back with a lot of gratitude. The opportunity to be able to give back and serve in all these capacities that I've had the opportunity to grow through.
Awesome. So I know, like, so you're finishing your assistant chief of service years in June. You'll be graduating or you'll be completing, and then moving on to your fellowship. What is your future aspiration? Like, what are you looking forward to?
So I'm excited about the next step. I'm looking forward to my cardiology training at the University of Pittsburgh, starting in July. And going forward, I'm very passionate about medical education. I see a career that will be focused on like several areas. One of them is medical education, helping to build the next generation of physicians, scientists, clinicians, educators. And so it's something that I would always want to pursue. And then obviously clinical work. I'm very much passionate about clinical cardiology, helping with cardiovascular disease prevention all across the globe. And there's some interventions, some projects that I'm working on with a couple of people geared towards Ghana, and then hopefully we can extend to some other African countries. So it's something I'm always looking out for when it comes to my public health focus. And then research is also the other area that I'm very much interested in. Using like our research tools to answer a lot of our clinical questions so that we can help our patients through the research that we do. And so I see a future that would focus broadly on this kind of three main areas, and then help to make the world a better place as much as I can.
Awesome. Well, we wish you all the best. But before we go, let's talk about your closing thoughts and advice for future or aspiring clinicians who want to take a path or who want to undergo this process. I mean, like it's been very insightful conversation, and I know our viewers are going to really take a lot of or learn a lot of lessons from this. But before you go, I want you to, give us some word of advice. Let's start with medical students. So for those who just started their medical career, let's say first year medical school or final year medical school, what advice would you give them? Especially for those who are saying, I want to do clinical residency, but I don't want to do my clinical residency in Ghana or in Africa or in Asia. I want to do my clinical residency in the United States. What advice would you give them?
So what I'll say is that you should use the time that you have in medical school as the time of like self-discovery. Interest will change, but I believe that like the early part of your medical like education or training would unearth some of the things that you're very much passionate about. I would encourage everyone to follow your passion. Whatever brings you joy, whatever brings you fulfillment, whatever field, irrespective, if it's pediatrics, if it's internal medicine, if it's surgery, there should be no roadblocks, anything that will limit you from pursuing your interest to the fullest. So that's one thing that I'll say for those that are starting. The other thing is seek out mentorship as early as possible. I think that seeking mentorship early as possible will help you avoid certain pitfalls or mistakes that you can make when you're going through your medical training. And some of these mentors will help shape even like kind of your action goals for your career. So seek out mentorship as early as possible. They will help you avoid certain mistakes. And it's fine to pursue your interests if you have to take a year off to do research, to do some exchange program. The experiences are golden anytime you get the opportunity. If you have the opportunity to do electives when you're in med school, especially for those that want to do their residency, like in the United States, if you have the opportunity to do clinical elective or even a research elective, you should go for it and use those avenues to build networks. And that's one of the things that I'm very much happy about. All the networks that I built throughout my time as like MPH students, as a postdoc, they are still people that I always go back to when I need like critical advice for my career. So I will encourage all medical students within this phase of their training to do that. And also understand that sometimes things may not work out the way you would set them out to be. It's fine if failures happen. And especially in medical school, when you start, you may probably have been like the top of your class in senior high school, and then you go through a very humbling phase when you notice that you're pretty much trailing in some of the courses that you're taking. But it's fine. It's always good to take a step back and reevaluate and get yourself back on track. So obstacles may come in, things that you don't expect, but always like get yourself together and then keep going.
All right. So that is for medical students. So let's say someone has finished their medical school, they are now doing their house job. I know it's in certain countries you have to do a housemanship training, or those who are in the early phase of their medical officer role. Let's say you finish medical school, from the time that you finish medical school to the fifth year of your practice. What advice would you give those people who are saying this is the time for us to make a move and take the clinical residency route in the US? What advice would you give those people?
So the other thing that I would say for people within this group is that if you have the opportunity, maybe funding or the means to do an advanced degree, especially those that are interested in research, or even if you're not interested in research, because there are so many other programs within the MPH, like health economics, public policy, and all that, especially looking at your career trajectory. And the other thing that I would say is that it's not everyone that may necessarily want to stay on as a clinician, and that is fine. If you notice very early on that that's not the path you want your career to take, it's also fine. You can seek out mentorship. I have people that I did my medical training with, or MPH with medical backgrounds, that are consultants in pharmaceutical or consultant firms, and or doing some public health work. If you're able to figure that out early, that this is not something that you really want to do, then obviously seek out steps to be able to move in that area. But for those that want to stay in the clinical field, if you have the opportunity to do an advanced training, I would encourage that. I would also encourage research work, especially if you're getting ready for residency application, if you can, as much as possible, as a house officer or as an MO. And there are so many avenues for research. Sometimes we look for like very glamorous like things before we say, oh, this is research. But the day-to-day data that you're collecting at the hospital, you can always kind of aggregate this and then get a really nice project that you can publish out of it. So you can use that time of your training to be able to get things together for research. That will be very helpful when you're applying for residency training. And then again, back to the issue of mentorship. This is also another phase where you also want to circle back with your mentors. And it's a very crucial time. It was through mentorship that I took that decision to do the MPH program, and then obviously getting the right mentorship to even decide on where exactly to land, which was Hopkins. And the rest, they will say, is like it's just an uphill right from there. So that's what I would say for people in this category.
Okay, so so for people in this category, really taking the step to add value to your medical degree.
Yes.
So let's pivot to another section of medical doctors who, for example, have graduated over 5 years ago, but they are still interested in going through the clinical residency training in the US. But they keep hearing that, oh, after 5 years, your chances are limited. After 5 years, you can't make it. What advice would you give those people?
And I think I maybe alluded to this at some point in the conversation, that it's not really just about how many years it's been since you left medical school, but then again, like what value you've added, what impact, public health or clinical impact you've made within the period. So I would just advise people within this group that don't give up. There's so many things that you hear when you're going through the application process, and so many people will try to deter you from applying. Sometimes they'll tell you, you're not even cut out for this program or this like residency training and things like that. But you shouldn't let those words demoralize you. One thing that I've noticed is that there's always an avenue for anyone that wants to go all out. So I encourage people within this category to go all out. And sometimes that may even involve like doing some clinical observerships, because again, like I mentioned, if it's been a while since you left medical school, everyone wants to be sure that you're still like in touch with your clinical training. So if you have to spend some time, maybe a couple of weeks, to shadow someone to do clinical observerships, I would definitely encourage you to do that. And then when you're applying to the residency programs, you also want to apply as broadly as possible to increase your chances of getting more interviews. Sometimes you can even like make contacts. And again, this is where like networking comes in. You want to network with as many people as possible, people that can know you, like can speak to your clinical training or know you from your training back home, and that are already in residency programs that can put in a strong recommendation for you to get an interview or even match in the residency program. So don't give up, and don't listen to all the demoralizing information that people will share across, that, oh, you're not going to make it and all that. You can do it so long as you put your mind to it.
Yeah. So if you are hearing this and you've been out of school for more than 5 years, you still got a shot. Don't give up. It's all about strategy. So Albert, thank you so much for making time to share your story and to tell my audience the exact strategies or what your experience has been as a clinical resident and as a chief resident. So thank you so much for your time. I know how busy you are. So we appreciate your time. Hopefully, we'll get to talk to you once you are in your fellowship training and update us on your progress. So thank you so much for being with us today.
Sure. Thank you for the time. Always happy to be back.